Good afternoon, Rotarians, guests, and friends. We are very excited about our program here today at the Hilton Netherlands Plaza in downtown Cincinnati. And we're so glad that you could join us today. Welcome also to those of you who are on Zoom, viewing our meeting via Zoom. Thank you for being here. We will begin our program today. We have a full agenda, so we will be moving pretty quickly. We will begin with the national anthem, which will be led by Stephanie Sheard, followed by the invocation and four-way test, which will be led by Steve Drafel. Stephanie?
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Very nice. Good afternoon. Let's bow our heads, please. Thank you, Heavenly Father, for bringing us together today to learn and share a meal and good conversation with friends, guests, and fellow Rotarians. We thank you for this venue, for the food you have provided to nourish our body, and for those who prepared and served it. Father, we thank you for the opportunity to live in a great country that provides medical care that is rarely seen in other parts of the world. We are blessed with skilled doctors, nurses, physical therapists, mental health professionals, and many other medical professionals that provide us care in some of our greatest times of need. They, like our speaker today, Dr. Cotton, encourage us to be preventive through exercise, diet, and a healthy mental outlook. Heavenly Father, their dedication to the field of medicine, and especially to the patients under their care, was never more evident than these last 2 years, as they worked long, arduous hours in a dangerous environment taking care of patients with the deadly COVID virus. Thank you, Father, for blessing us with such caring people, some who gave their lives in the care of others. They truly are godly servants who put service above self. Amen. And now please join me in reciting the four-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Thank you. You may be seated.
Thank you very much. Next, we will have our Sergeant at Arms today, who is Kelly Collison. And Kelly will be followed by our meeting sponsor today, the McGilligan Group, with our own Dr. Becky McGilligan.
Thank you, President Melinda. I'd like to welcome our guest today. Andy Cassidy is a guest of Esteban Calle. Please stand. We have Shelley Shire, who is a guest of Jeff Weir. Welcome, Shelley. Dr. Frank Dumont, who is a guest of Becky McGilligan and is with Direct Primary Care, our sponsor today. Dr. Frank. We have Rick Peskovitz with Under the Weather, guest of Kelly Mahan. We'd like to welcome back one of our members who travels a great deal and is here today with us, Adriana Ritchie. Welcome back, Adriana. We'd also like to welcome back and give a round of applause for all the efforts. Mr. Nathan Thomas is with us today. And Nathan. Many of you know Nathan. Nathan is the district governor-elect in North Carolina in his 20s. And may I also say that he's a proud Bearcat returning back home to Cincinnati. And he is the CEO of a project that was born right here out of Club 17. He's very proud of Solarized Uganda Now. He's also with his CFO, RJ Abel. Big round of applause for Nathan and RJ. I understand that Nathan is working on well over 50 installations in Uganda with all of your support and the support of many Rotarians. Congratulations and thank you for your work.
I'm Becky McGilligan. I'm an internal medicine physician, and I own McGilligan MD Direct Primary Care in Anderson Township. We have 3 physicians in our practice. Dr. Frank Dumont is one, his daughter, Dr. Catherine Dumont, is the other, and then me, so there's more Dumonts than McGilligans now. But we love spending time with our patients and getting to know them. It's a smaller practice. None of us have more than about 500 patients apiece, which is not a lot for a primary care practice, and we get to spend more time and get to know everybody better, and we're just really happy to be practicing medicine kind of the old school way in this new world.
Thank you very much for being our meeting sponsor today. Next, we have 2 Paul Harris Award presentations to members of our club, and that will be done by 2-time past District Governor Bill Shula. Following Bill and the 2 Paul Harris Awards, we will also have an announcement regarding the women in Rotary, and that announcement will be made by Amanda Forsey. Bill?
Right. Thank you, President. Rotary's been about service since 1905, and its first major project was in the Chicago area with a water sanitation project. A Clevelander, Arch Klumps, started the Rotary Foundation in 1917 at the Atlanta International Convention. And this thing I couldn't quite understand. The first donation was made by the Kansas City Club of $26.50. It wasn't done by the Cleveland Club. I don't know. I'd have to do a little history on that one. Following the death of Paul Harris in 1947, the foundation increased significantly. In 1957, the Paul Harris Society was formed to recognize humanitarian giving. Donations made to the Rotary Foundation or Polio Plus qualifies for this distinction in the amount of $1,000 or more, one of the most solvent foundations in the world. Paul Harris Fellow, an appreciation of tangible and significant assistance given for the furtherance of better understanding and friendly relations among the peoples around the world. We recognize our Rotarians for this service and for their donations to the foundation. We are a service above self, and our Rotary Club has also received significant funds through Rotary International for our local projects and our international projects. So today I'd like to recognize 2 of our Rotarians, our President-elect, Steve King. He is Paul Harris Plus 1. And Brett LeBar, past president, for a plus 4. Plus 4 means he's in the $5,000 range of giving to Rotary International, and Paul Harris Plus 1 is in the $2,000 range. And if at level beyond that, particularly you work for a Paul Harris Society member as well as a major donor at the $10,000 level. So congratulations, sir. Thank you. Please, thank you very much.
All right, ladies, this one's for you. The Women in Rotary has put together a wonderful event to be held on May 21st from 10:30 to 1:30. We're having our Women's Wellness Day. Nancy Reese has been so gracious to host this at her home. We'll have a beginner yoga session, a vision board activity, and some breathing techniques to help us de-stress and relax. HDC Group, Allie Hubbard, is sponsoring the vision board activity, so most of those supplies will be provided. But please start looking for words, pictures, anything that represents your goals and dreams to bring with you. We recommend that you dress casual, comfortably for the yoga and bring a yoga mat if you plan to participate in that. If you have any questions, you can reach out to myself or Mary Smiley. Thank you.
Thank you for those announcements. As I've shared with you earlier, we have several ad hoc committees that have been working behind the scenes this year to present to us some new, efficient, more effective operational procedures of how we will be conducting our office staff work and also our meetings and events. One of those committees the research was done by this committee for a more efficient financial module, and that was spearheaded by our own Kelly Mahan. Let's give Kelly Mahan a round of applause. Kelly, please stand. Kelly did a lot of research. We really appreciate her efforts on that. And with that, you will hear about some upcoming changes in just a minute here. So for next, we will have a presentation on that particular ad hoc committee, an update from our executive director, Sarah Pattison. Following Sarah will be Camp Allen 100-year moment, again by Mike LaValle. We've all enjoyed those updates that we've received from the foundation related to Camp Allen and our project and our 100th year celebration coming up. So first we will hear from our executive director, Sarah Pattison, with this particular ad hoc committee and some changes upcoming, and then from Mike LaValle.
Good afternoon, Club 17. So we wanted to let you know that officially, as of yesterday, we are changing our club management tool from Club Runner to DACDB, which is very exciting because DACDB is made by Rotarians for Rotarians. It's going to save the office money as well as at least 100 hours of our time. It's just extremely efficient, and it's great for all of you as the members because it's going to be your one-stop shop for all things Rotary. Events, calendars, contributions, everything is going to be in DACDB. We're also getting the finance module. So again, it's going to be great. And in the next week, Christy will be sending out an email to everybody on how to register your account if you don't already have one. So be on the lookout for that. And thank you to Kelly and Steve. I'm very excited about moving this over. Thank you, President Melinda.
Hello, everybody. I'm here, as Melinda said, to talk about this week's iteration of 100 years of Camp Allen. And we've been doing this for several weeks now. And last time Fred Fisher finished off with 1928, which was, I've got the zapper here. There we go. Yeah, okay. Let's go. In 1928, which was when we actually contracted with the railroad to buy the 40 acres at Camp Allen. And that was for $6,000 for 40 acres. Today we're moving ahead by a few years. In 1930, the deal for Camp Allen was finally consummated, and at the cost of about $8,500. And that's because it took 2 years to unravel all the legal webs and titles and surveys, all that kind of stuff. So it ended up costing us about, let's say, $8,500. So the club put down $2,000, and we financed $6,500 at 6% back then. But that's in 1930 when we actually began to own Camp Allen. And that same year, we appropriated $2,000 for lumber to build a caretaker's house on the property. And just FYI, that's the same year that this hotel and the Crew Tower was built. 1932, we raised $6,000, which is about $113,000 in today's money, for Camp Allen, and the camp ran for a full 8 weeks, and we completed the caretaker's house that year. And these pictures that you see up here now are from an article from 1934. Actually, the last one was too. This was a full-page article in the Cincinnati Enquirer, August 18th, 1934. It was all about summer camps. It was a series, and I believe it says up there, it was a series of 8 different summer camps they went and talked to, or wrote about, and Camp Allen was one of them. So that's where these pictures came from. You can see the collection of kids there. If you looked hard, you can see wheelchairs and crutches. Upper right, you can see there's a cabin in the background, some swings, and a merry-go-round. So also then in 1934, we were able to build a shallow wading pool at Camp Allen. Now they called it not a wading pool, wading pond, and it was actually built out into the lake. They put up some concrete walls and trucked in some sand and made a swimming area as part of the lake. And that's what you see on the bottom. And on the upper picture is one of the boys' cabins. And after lunch every day, they had an hour and a half worth of time where they just spent in their cabin, supposedly resting, but I went to summer camp and I know how that goes. So it looks like they're doing something that they're supposed to be doing anyway. So then in 1935, one of the first things that we did that year was we paid off Camp Allen. So in those 3 years, we had it paid off, and it was all ours. So these next couple pictures are also from that same article, but it just gives you a great idea of what went on there at camp. In that upper picture, you can see there's a boy, a batter up there. He's standing up because he has crutches. The young man on the left, he has no legs. His right hand is also deformed, or he was in an accident when he was younger. So he's playing catcher. And the guy on the right back there, he's the designated runner. So if anybody that couldn't run, it was his turn. He was the designated runner. And then on the bottom portion of that's girls reading stories. Now this picture is pretty interesting. When you imagine back in those days what kids like this probably had to put up with on a daily basis. This kid obviously didn't mind when he was at camp. I mean, look at the smile on his face. And with the lack of legs, this fellow, they said, was fairly spirited, and he was the dizzy dean of camp. And he loved being the pitcher. And there was a couple of leagues because there was enough kids out there to actually form teams, and they ran baseball leagues. And then this picture as well is from that 1934 article. And again, you can see just some girls playing, and those are the kids that are in that small waiting area, pool, waiting area that was part of the lake. So that's today's Camp Allen Minute. And as I said at the beginning, I want to make sure you all put on your calendar that the party is going to be August 17th. It's going to be out at Camp Allen. And at that point, oh, you know what? I forgot. I got to zap through this. I told you I'd bring you up to date as to what's going on out there. Here's one of the new structures. This is the bus stop that's under construction. Here's the new entry in front of the main entry into the dining hall under construction. Underneath there, you can see you've got the windows. All the windows are in. Some of the trim is up. We're getting ready to start putting up the siding and painting. And then there it is from the outside. So we're moving along. So by August 17th, it's going to be completed before campers start this year. That's the goal. And for August 17th, we'll all be out there and we'll be unveiling the new Rotary Hall and having a good party just to celebrate Otating Egg for 100 years. What'd I say? August 27th, whatever I just said was wrong. So 27th. Thank you.
Thank you very much, Sarah, for that announcement, and thank you very much, Steve, and foundation members. And the president of the foundation is Owen Rassman, and he's been working very, very hard this year. Let's give Owen a round of applause. Owen, please stand. Thank you so much for all that you do. Next, we have some birthdays today. Let's help our members, our Rotarians, with birthdays, celebrate their birthdays. April 26th, we had Jim Wilson and Jack Estelle. And Jack is here today. Stand up, Jack. Saw Jack earlier. Okay, Estelle. April 27th, Dave Ziegler, and April 28th, Ron Luckenbill and Tasha Stapleton. Let's give all of our Rotarians with birthdays a round of applause. Next, we have Split the Pot, and I'll ask Dr. Cotton to pull the winning ticket. Everyone is eligible for the first winning ticket pull, and then Club 17 members are eligible for the accumulating pot. The winning ticket, the first pull, is for $59, and the accumulating pot for Club 17 members is at $1,582. So first ticket draw.
Last four digits are 3820. 3820.
That's good. Last four digits, 3, 8. Oh, there we go, 20. Is that Jack Scott? Jack Scott. So 3820. Jack will be pulling for the Queen of Hearts. Okay, that's Oh. I'm sorry? He's donating the $59 back. Thank you so very much, Jack. That's so very kind of you. So Jack won the $59 and is putting it back into the accumulating pot or for the membership development efforts, which 25% of the funds raised go there. We have one of the most important areas coming up soon. We have the election of board members coming up. The very first part of that is the nominating committee. The nominating committee is designed by and decided upon with the president nominee. Our president nominee this year is Doug Bolton, so he will be deciding upon the 4 at-large members. The 3 members of the nominating committee are the current president, myself, president-elect Steve King, and president nominee Doug Bolton, and then the 4 at-large members. Now, please remember, there are 2 different issues in 2 different areas. The nominating committee is one. The nominating committee decides on those people who have been recommended to serve as a board member or a board officer. So these nominating committee members are not part of the board officers. They are the ones who will be deciding on the recommendation that goes to the current board members. But if you have any questions about that, see any of the board members, or certainly you can see myself. We have a little bit, we've put in the E-Raise before and in the club highlights the process for the election of board members and officers, and we've been reminding you we have a process in place to make sure that that's as clear as it can be. But when you're new, sometimes it may be a little bit confusing, so feel free to ask any one of us if you need any clarity on it. So up here we have the election processes. The deadline to express your interest in serving on the nominating committee is May 1st. That's coming up pretty quickly. President nominee Doug Bolton couldn't be here today, but he says he's gotten a great response, but wanted to make sure you know that there's still a few days if you haven't contacted him yet. The nominating committee is voted upon and approved by the club's board during the May board meeting. And then the nominating names that will be serving on the committee and the committee at large will be shared by the president nominee, Doug Bolton, by the first week of June. Once that happens, that's when we will send out to you, and that will be done by president nominee Doug Bolton, a referral or recommendation sheet for anyone who would like to serve on the board as a board member or as an officer. You can also recommend yourself if you would like. That's fine. There's a form, and that form will come out once the committee has been approved by our board. So we've gone through this 2 or 3 times, and you've seen the information in the E-raise and in the club highlights, but just to try to make it clearer to you, and we really do solicit your information. This is your time to share your interests and what your recommendations will be. We will have a membership meet and greet. We called our members during COVID we are still doing that, to touch base with members, to just see how everything is going, if there's anything we can do or to help encourage. And as we called our members, the board members did, they encouraged us as well. We've had a lot of different situations and ups and downs during these times, so it's nice just to hear from other Rotarians. From that, several members said, why don't we get together as a family? We need to have an event. Miss seeing people. We've got many new members that we haven't seen in a while. So we have a new member who is Matt Nephew, who said, I'll take the lead on that. Some of you may have remembered Matt. He said, I'll be glad to do that. And also one of our veteran members, Dr. Ken Manges, said, I'll be glad to assist as well. So our meet and greet Rotary Mixer will be Tuesday, May 10th, the first one, and it will be hosted, actually our president nominee secured the location for us. That's Doug Bolton. We will be at the Scripps Center on the 10th floor from 4 to 6. And some other members have heard about this meet and greet and Rotary Mixer, and they said, well, this is great. Let's have one of these once a month. So I've told President Steve to put that on his list of things, too, to add as we have a few more months at the end of this year. I think it's great when we can come together and see each other and share and learn about other people, their vocation, and not just a vocation, but what are you interested in doing. And so that was a beautiful rendition of the national anthem by Stephanie Sheard. How many knew she had that? Let's give Stephanie a round of applause. So we're looking forward to that. Please put that on your calendar and don't wait till the last minute, if you would, please, so the office will know how many people to prepare for May 10th for that event. We're really excited about it. And I did have one member said, well, we want to do a little more than that more often, and maybe we could even come into each other's homes. But we still have a number of people who are concerned yet about the virus, so I don't think we want to go to that extent just at this moment. But we look forward to that. With the family of Rotary, Rotarian Bob Ballot, who was awarded the Greater Cincinnati Earth Coalition Environmental Award. That happened this week. We want to congratulate Bob for that, Rob for that. That was listed in the Greater Cincinnati Earth Day Festival. And some of you may have heard him when he spoke to us as a club. He's a great speaker, and he's done a lot for our community. Please keep longtime Rotarian Julian Mangus in your thoughts and prayers. He recently had a fall, and after that fall, he has had some additional health concerns as a result of that. He is moved to the Twin Lakes Senior Living Community in Montgomery and is continuing his rehabilitation efforts. He has therapy 6 days a week, so he has limited time for visitors, but he welcomes cards and letters. So please keep that in your mind, and also refer back to the club highlights. That information will be in there as well. Our past executive director, Linda Muth, please keep her and your family and her family in your thoughts and prayers, as her husband, Tom, passed away on Sunday, April 24th. He died peacefully, she said, in his sleep, surrounded by family. And Linda was planning already a celebration of life in an open house that she will continue to have. It will be hosted on Sunday, May 15th, and it will be from 1 to 4 o'clock at her home. And so as Rotarians, we are a family, and Linda was an executive director with us for over 10 years, and she did an outstanding job and did a great job hosting the large club conference right before she left, and we want to show love and support for Linda. With that, Nancy Reese has stepped up to be the liaison between Linda and our club. Stand up, Nancy, so people will know who you are, please. Nancy Reese. Nancy and Jerry have been there, and a number of other people have been by Linda's side during this time. Some that whose names she's mentioned. I won't go through the names now, but she really appreciates those efforts. So if you're interested in helping with the setup or any of the food that the things that Nancy and Jerry are working on for Linda, please contact Nancy. You can find her information in the directory, or you could see her after our meeting today. But we do want to show love and care and support to Linda during this time. So please send your RSVPs if you would like to participate and come. Send those RSVPs to Nancy Reese, as she said, just as we talked about with May 10th, so we can know how many people to prepare for. And Linda is welcoming any of you who would like to stop in and say hello. So again, Nancy Reese, thank you so much for stepping up to do that. Next, we have 2 meetings this afternoon after our Rotary meeting. The Environmental Sustainability Committee will meet in the Julep Room on the 3rd floor here. And the Women in Rotary, as we had such a great announcement by Amanda Forsey earlier, that committee will be meeting in Boardroom 4 on the mezzanine level. Next week, our meeting will be Evans Maraji, the Harry T. Wilkes, Artistic Director of the Cincinnati Opera. And so we're looking forward to that. And now, without further ado, we will have our meeting for today, and our own board member, Tony Archery, will introduce our program. Welcome back, Tony. Glad to see you, and we look forward to hearing about our program for today.
Thank you, President Melinda. I'm glad to be back. Thank you. Hello, everyone. I'm excited today. Dr. Sian Cotton has made an amazing contribution to the science of health and wellness, and we are privileged to have her here in the Queen City and here to empower us today. Moreover, her knowledge of caring for the spirit, soul, and body are life-sustaining and needed in this second-by-second, fast-paced world that we live in. She has the credentials and has demonstrated them effectively as the founding director of the University of Cincinnati Center for Integrative Health and Wellness and UC Health Integrative Medicine, and all around the world to become a leading authority in the science of health and wellness. Myself and my family have been truly impressed and impacted by Sian's leadership for many, many years, and continue to be astounded by her sky is the limit philosophy. Please help me welcome none other than Dr. Sian Cotton.
Thank you so much, Tony. I'm on my lavalier. Can people hear okay? I tend to move around. Thank you, Tony, for the kind introduction, Madam President, for having me here. It's really fantastic to be here with you all, and I appreciate the time. Before I start talking a little bit about transforming what we have mostly in this country, which is a disease management system rather than a healthcare wellness system, I do want to thank the physicians in the room, all of the practitioners who care, as our earlier speaker said, for people every day. We have an incredible healthcare opportunity in this country, and we do a lot of good. But I'm going to share some things today that I think we might be able to shift a little bit and really continue to improve the lives of our community. So the first problem I'll start with, and then I'll give you some good news, and we know this, particularly our physicians in the room know this, is our crisis of chronic disease, both mentally and physically. We have an unbelievable crisis. It's really overwhelming. It's unfortunately become even more overwhelming with COVID and the pandemic. What's not often talked about as much, or that we don't think about, is that 75%, an estimated 75% of these chronic disease are in large part related to things like healthy behaviors and lifestyle. And these are things like heart disease, cancer, diabetes, obesity, hypertension, chronic pain. Many of these things have a heavily influence with how we move every day, how we eat, how we manage stress, how we connect with the world. So here's a picture from the RAND Corporation of just showing you the trajectory that we are on. Again, some people in the room aren't surprised to see this, but this is a trajectory that's unsustainable. It's not sustainable for our communities. It's not sustainable for our children and our grandchildren. It's certainly not sustainable for our finances. And so this is unfortunately the projection of where we are. We also look at expenditure. So healthcare expenditure, we spend in the United States about 17.5% of our GDP on our healthcare system. 17.5%. I know I have a lot of business people in the room, and what you'll see below are countries like Sweden, Switzerland, the UK, Germany, Netherlands. We far outspend other countries. And unfortunately, and I don't have the slide to show you today, we unfortunately have some of the worst health outcomes. So something has to be fixed, and we know this, right? We've been listening for years, decades. How do we fix this? What can we do differently? So again, I'll just highlight the preventable nature of many of the chronic disease that many of us in the room live with, our loved ones live with. Heart disease, cardiovascular disease, #1 cause of death in the United States. We know that there's data to suggest that with lifestyle change, we can actually reverse things like coronary artery disease. 1 in 3, and unfortunately the data is closer to 1 in 2 now with cancer. 1 in 2/3 cancer cases are sometimes preventable and directly linked to lifestyle. And then we know that issues with overweight, obesity, and then the consequences that come with that. I promise you there's some good news, but I'm making my case now. And what's the problem? We have about 156 medical schools in this country. Our medical school here at UC, we graduate 176 medical students a year. Incredible. My brother's actually a 4th-year medical student graduating this weekend. But we don't actually teach this still. And again, I'm going to share some good news coming from your own university here. But we don't teach this. And you wonder why when you go into your physician's office, you primarily get maybe a medication, maybe they're checking your blood pressure, this and that. But what about the impact of food, exercise, stress? If we're not teaching it, our students get on the other side and they don't actually have good models to go from. They don't have good models, they don't have the data to share with you as their patients. So on average, again, this might surprise some people in the room, US medical schools offer only 19.6 hours of nutrition. And my friends, medical school is 4 years long. 4 years, which is sometimes when you ask your care providers questions about gluten-free or what's good for this or what about that, this is not something that in general we are teaching. Now again, we're getting much, much better about this, and I'm going to share some of that. But one of the questions, and again, some of our primary care docs in the room might think, how do you prescribe lifestyle changes? How do you actually build this in, right? And I'm sure we tell patients, lose weight, reduce your stress, you need to start walking more and exercise and moving. But we don't actually have a healthcare insurance business that covers those things, right? So, they don't cover prescription, they don't cover your gym memberships. And most of us in the room can probably afford a gym membership. They're not going to cover many of these things. So how do we build this into our healthcare system? If we know that lifestyle behavior is related to the chronic diseases that are tanking our healthcare system, how do we build a healthcare system that actually starts to shift the model? I'm actually going to have you think outside the box with me. How do we actually shift the model so that this is not the trajectory that we're on 10, 20, 30 years? Second problem, and I could just stop right here. We are an over-medicated country, and everybody knows that, right? And this is a little bit tongue-in-cheek, so to speak. I take metformin for the diabetes that's caused by this, that I take for the high blood pressure, and then I take my Ambien, and then I can't, so it goes on and on and on. And so we're over-medicated in large part because it's one of the things that's paid for by our insurers is medication and physical therapy, right? It's paid for and it's accessible, but we've created an opioid crisis in this country like nobody's business, right? And so I'll just share a little bit. We all know about the opioid crisis. I'm not going to spend time on that. But I'm going to spend time on the fact that the Joint Commission, which is the accrediting body that accredits your hospitals, the Joint Commission before 2019 used to recommend it's okay if you offer non-pharmacologic approaches for pain management. So if you're in the hospital, they used to say, we recommend that your care provider team offer you some other things that we know work for pain management, like acupuncture. But as of 2018, you'll see now it's a requirement. This is a fantastic policy move because now the hospitals are thinking, what do we actually offer? And most offer cognitive behavioral therapy, but we're still not offering lots of things. We're not offering mindfulness meditation, acupuncture, massage therapy, chiropractic, many of the things. The VA system is doing it. They're doing it much better from a national perspective. And again, these are the modalities that we're looking at: acupuncture, chiropractic, osteopath, massage, PT, different things. How many people in the room use one of these modalities, have ever used it before? How many people probably had to pay out of pocket for it because their insurance company doesn't cover it yet? Yeah, the good news is in the state of Ohio, we have the best acupuncture coverage besides the state of California in the state of Ohio. And I'm thrilled to tell you all that UC Health has 3 full-time acupuncturists, now a 4th. We're covered under about 12, 13 insurance plans. So we have opened up access to tens of thousands of patients. Again, I just put this up here. Again, our docs in the room know this, but this is a scientific article from the Annals of Internal Medicine. So what's happening in the journals, in the medical journals, is the medical journals are saying, hey, by the way, and this was from 2019. This is kind of the premier internal medicine journal. And in 2019, this is what the journal said to our practicing internists and primary care docs. For patients with chronic low back pain, you should initially go to things like exercise, rehab, acupuncture, mindfulness-based stress reduction. So what's happening is the science is far ahead and saying, hey, we know these things work, and you should be recommending this. And then we don't have a healthcare system that supports it, because dietitians in the state of Ohio, unless you already have type 2 diabetes or you're in line for a kidney transplant already, that's when your insurance company will pay for a visit with a dietitian. I'm sorry, what? Like, that's just not sustainable. So there's a mismatch. And so what are we doing? What are we doing at UC? And think outside the box a little bit with me about what we could be doing. So our goal at the center, which I founded about 10 years ago, was to help transform a system of disease management and kind of disease care to one of wellness care, where we actually start to flip the model and we start to tell people, hey, did you know, and I mentioned this, that you can reverse coronary artery disease in many cases with lifestyle changes? Did you know that? And guess what? We have a program here for you to hook you up with a health coach and a dietitian and an exercise therapist, and guess what? Your insurance company pays for it, right? And so getting back to the foundations of how we move, how we eat, how we manage stress or we don't, and how we connect with the world around us, spiritually, even just this community, this fellowship here today, these are the foundations of wellness. So these should be the foundations of what we do in a health care system, rather than management of disease all day long. And if I haven't said it 6 times, it should be paid for by our insurance companies. So when we founded the center about 10 years ago, my goal was to not develop a separate center. So if you go to Duke Integrated Medicine, if you go to UCSF, if you go to Vanderbilt, Harvard, these are all of our colleagues. They do wonderful work, but they have an integrated medicine center over there that you have to go to. No. So our goal here at UC and what we've been building is an embedded model. So I want to strengthen our cancer center. I want to strengthen our neuroscience institute. So when you walk into the Gardner Neuroscience Institute and you look up the board that has all the physicians' names, it also says acupuncture on the 2nd floor. It says Tai Chi on the 1st floor. It says massage therapy, because this should be embedded. So the goal was always to strengthen all of the existing programs in the Centers for Excellence that we're already doing. I'll just highlight this group. So again, I mentioned we have 156-ish medical schools in the country. 76, my friends, that's now half are part of this academic consortium. These are the other people, the Harvards, the Dukes, the Stanfords, that are doing what we're doing. We joined this group in 2009, and these are the people that are changing the way we teach our students, doing the research, doing the clinical care. I'm happy to say I'm the new elected vice chair of this organization. I'll be chair, which just gives Cincinnati an elevated platform to say, you know what, we can do this differently. Thank you. And Cincinnati and all these other 75 schools are going to lead the way. We're now half. We should now be lobbying, which we're doing in every state, by the way. So what does integrative healthcare look like? It looks like, in addition to pain medication or any medication, I've taken Lexapro, I've taken Ambien. Medication's great. But in addition to that, why should we not also be offering acupuncture, for example? How about for stress? Again, I've taken Lexapro for stress myself, but guess what? In the DSM-5 that we all work off of, in our book of diagnostic manuals, it says that mindfulness-based stress reduction has enough data that we should be doing it. Let's offer this. We're not doing this at UC. Where do we treat heart disease in this country? In the OR, right? This is what we do. Put the stent and do this. What about starting first with lower cost behavioral interventions that we know work, and then move to this when we have to? right? But why not flip the model and start earlier with lower cost, less invasive procedures? That's what integrated medicine's about. So again, let's look at food and exercise before we put someone in the OR as a first line. So integrated medicine combines conventional medicine, which is incredible, with evidence-based therapies that have a strong focus on things like stress, nutrition, movement, sleep, environment, to overall reduce suffering and promote wellness. I'm going to go quickly again because I'm mindful of the time, but lifestyle medicine, this is our new medical director. Yes, Dolores is here with me, and Tammy. We recruited Dr. G from the Cleveland Clinic, who'd been there for 30 years, and he was ready to come and join us. So he's our medical director, and basically this is where lifestyle is the primary mode of intervention, and then you move to other things, as opposed to let me give you all this and then, by the way, go lose some weight. So he actually sees patients, consultations, he's covered under insurance. Let me say that again. He's covered under your insurance plan, because there's a lot of people that do this work in our community, and because it's not paid for by insurance, it's only accessible to maybe 5%. So my goal was to build a program that was accessible to everyone. This is a quick clip of some of our team. Let's see if it works.
Hello, my name is Mladen Golovic. I'm currently a medical director at the Center for Integrative Health and Wellness. By training, I'm an internist, certified by American Board of Internal Medicine, as well as American Board of Lifestyle Medicine. One of the passions in my life has always been focusing on self-care. What we as individuals, as patients, can do to improve our health. What I provide here is lifestyle medicine consultation. So we see patients, or even those who are healthy and who want to stay healthy, in 1 hour consultation. As I listen to them, I make suggestions when I see that there is some room for improvement. Then, in agreement, in collaboration with patient, we make a plan.
My name is Dr. Melissa Erickson. I am a family medicine physician, and I am the medical director for our cancer survivorship program here at the UC Cancer Center. My patient population is essentially patients that have active cancer or a history of cancer. And I provide care both in the form of survivorship consultations, as well as providing their primary care for these patients. One thing that I have found is that integrative medicine services are really important for my patients. At the beginning of this year, we founded the Cancer Wellness Center. And basically, it's a multidisciplinary effort that combines cancer survivorship, oncology primary care, massage therapy, acupuncture, lifestyle medicine, exercise physiology, and nutrition. And it's a way that we can better provide comprehensive care for our patients.
We're gonna have you climb aboard here. All right. And if you can relax your arms down whenever you're ready, I'm gonna take your pulse. So in Chinese medicine, when we take the pulse, we're not just looking for the rate, but we're looking for the texture and how it feels in 3 different positions and 3 different depths. They tell us all sorts of different stuff about the interior and the organs. And each position on the left and the right hand represent different organs. Generally, you shouldn't have much discomfort. Sometimes you can have a little bit of what we call a zing, which is just a quick sensation, usually goes away immediately, but you shouldn't be any kind of sustained level of discomfort. So while we're doing this, just feel free to breathe normally. You don't have to do anything special. But we also want to avoid holding the breath, because that can bring in some tension and a little bit of resistance. Right, you're all set. So I recommend taking it easy for the next few hours. If you haven't eaten much this morning, have a little snack and drink some water. So we're gonna have you slowly make your way on up and see how you're doing. You able to relax a little bit on the table? Yeah, and nothing bothering you too much?
No. So what is mindfulness? It's being in the present moment without judgment. It's setting the intention to pay attention to this present moment. So go ahead and find a nice comfortable position. This is what we call meditative position. So you might uncross your legs. And if it feels okay for you in this moment, you can close the eyes. If not, just take a soft gaze downward, blurring the vision. And just start to settle into stillness. Just start to notice what it feels like. Noticing without changing or manipulating the inhale and the exhale. Noticing where the breath goes in the body. Noticing what it feels like to breathe, all the sensations associated with the breath in this moment. And we'll take one final deep, deep inhale through the nose. Beautiful. One final deep, long exhale out through the mouth, sighing everything away. And when you're ready, you can gently blink open the eyes, coming back to this present moment, noticing how you feel.
We have to learn about 4 things in order to be really successful at health and wellness. Good nutrition, and that's basically plant-based nutrition. Exercise, something you need to do every day, and the older you get, the more you need to do it. Living in a connected society and participating. And the 4th is living a life of purpose, being able to continue to be involved throughout your whole life and career.
I think it's valuable for every community to have an integrated health and wellness program. I think it's valuable for every human being to embrace their personal responsibility for their health and wellness, and to be a collaborating member with their medical professionals to understand what tool belt that they have to help themselves and work with their physician. Let the physician also help them as the patient.
That was a little bit of our team. So I know that we're almost at our time, so I'm going to go a little quickly, but I'm happy to share these slides. I'm just pleased to say that we've brought all of these things to UC Health, and we're continuing to grow. Acupuncture, massage, Tai Chi for Parkinson's, yoga for MS, music therapy, art therapy, all based in the context of health and wellness and good science and medicine. We're doing a lot in the education space. I'm so pleased, and I know we have some Bearcats in the room, to say that at the University of Cincinnati, we now have an undergraduate certificate where you can be studying whatever. We now have a graduate certificate in integrative health that just got approved. We have nurses, PTs, people contact us and say, how do I learn? We have an integrative health minor, and we're going to continue to build. These are just some pictures of some of our students. We do a lot in the wellness space. I was so pleased to hear that. We do a lot around students and our faculty and our trainees learning to take care of themselves. We do a lot in the research space, mindfulness for anxiety, music therapy for at-risk use. We work at Children's looking at therapies with some of the kids at Children's. Carrie and John Hayden, who some of you may know, Carrie serves as our chair of our advisory council in the community. Tony is one of our wonderful advisory council members. They funded a chair, so we are currently recruiting a research endowed chair in integrative oncology to come and help us build out the research specific to integrative oncology. We do a lot of work in the community. I'm so excited, particularly around workplace mindfulness. So our colleague Meredith McGraw, we work with P&G, PNC Bank, Cincinnati Museum Center, really trying to take some of these things into the community, into CPS, places where we can make a difference. Again, we do work, the same work down at the Free Store Food Bank. Our goal is to get outside of this, UC and get into the community. That's why we're here, is to serve our community. A recent wonderful thing for us was we're in the process of a name change. We had a wonderful $5.5 million gift from the Osher Foundation, Bernard Osher, to become now the 9th Osher Center for Integrative Health in the country, along with Harvard, UCSF. It allows us to endow our medical director, our education. It means for me that the first step of my work is done, which is we will never go away, because we now have to be here, because once you endow centers, they stick around. So what it also means is that we just get to to continue to do what I believe is the work that we need to do in healthcare. So I'll wrap up by just asking you to imagine with me, we currently have a wonderful health system. I'm going to go in for a procedure tomorrow morning in an outpatient center, tertiary care, basic science, right? Sort of the predictive ability to really predict where we're going as patients and as communities. But imagine with me, and I'm going to say it's funded, right? Imagine with me, healthcare systems that included exercise therapy, teaching kitchens, and chefs, mindfulness and wellness centers, health coaching, acupuncture, and I'll say it for the 10th time, let's get it paid for. So not just 5% of our community has access to this, but everyone in our community, because we all know about the racial and the health equity disparities when it comes to health, and we have to fix this, which means we have to get it paid for. So I will wrap up and just say we would love to see any and all of you Saturday, May 14th, 9 to 3, wear your yoga pants. It costs $25 to show up. If you want to be my guest, just come and say I'm Dr. Cotton's guest. We're going to have a day of science and wellness and experience and practice. And a lot of these things you heard about today, you can actually experience, and you'll hear a lot of the science. So I know I am past my time. I apologize, Madam President. We have our website, our newsletter. Dolores is here with us. Make an appointment, come see us. Again, pleasure to spend time. I'm sorry I had to cruise through. I don't think we have time for questions, or maybe one or two. I defer to. Okay, I think we have time for one or two. Yes, ma'am. You're welcome. Sure.
And he was talking a lot about the connection between the gut and the brain.
Absolutely.
And my question for you is, how far away do you think we are from seeing primary care physicians doing the kind of testing that...
Great question. Probably a better question for our primary care docs in the room. I'm actually a psychologist by training, so I'm going to defer to them on that. But I would say that a lot of the testing right now is, again, very expensive, and you have to pay out of pocket. Mark Hyman does functional medicine work up at the Cleveland Clinic, has built a great shop, but you have to pay like $3,500 to go get a consultation with him. That's not okay with me. We do have to follow the science, and the science around gut health, the microbiome, mental health, physical health is incredible. I don't know the answer of when it's going to happen. I think it's going to happen, but what it's going to take are the primary care docs and you all in the room saying, hey, hold on, we should offer this in my practice. How can I help you do that? How can I help advocate for a different health care system?
Do you see that being a conversation?
I hope so. That's why I'm here.
Yeah.
That's why I'm here. Thank you for the question. One more, maybe? Yes, sir.
I see a variety of different medical experts, and I take about a handful of pills every day on their recommendation. So how can I do what you're advocating and kind of counter what they're telling me to do?
So I wouldn't at all advocate that you counter anything. Listen to your docs. I hope no one hears me say that, right? It's adding to your toolbox. First of all, the VA has the best integrative care system in the country. They've been covering chiropractic benefits for veterans since like 1997. Like they actually have many, many of these services. But I would say to them, whatever the condition is, if it's for heart, maybe it's pain, I would say, what else do you have that maybe I could do in addition to my pain medication? Do you have things like stress reduction programs? Do you have things like acupuncture? So I would ask them, because again, the VA has a lot of it available, and sometimes if we're not training, this is part of the issue with why we're getting into our medical school. And by the way, as of next year, wellness is one of the core 4 pillars in the curriculum, and they just agreed to pay 10% of my medical director to be a lifestyle medicine course director. The reason I'm saying it is this is one area of medicine that is driven by the public. It is not driven from inside the medical school. So I would advocate to you and anyone, ask the question, what else do you have for my sleep? What else do you have for my chronic low back pain that could be helpful? Because I know there's lots of other things that can help. Do you offer that here? And then I'll also give you my card and I can see if I can give you some suggestions. But ask your teams, what else do you have and where can I go?
Thank you very much. That was a dynamic presentation on integrative health and things that we can do with some suggestions. Let's give Dr. Cotton another round of applause. Thank you so much. And thank you very much, Tony, for making sure that you went through the process to make sure we could get her here. She was a very busy woman, so it took us a couple times for her to be able to pencil us in on her schedule. So thank you. And on behalf of your presentation today, we will give a donation to Rotary International for the eradication of polio, and we will give you a theme pin this year, which is Serve to Change Lives. Thank you again very much for being with us today. A reminder that Nathan Thomas will be here with the Uganda Sun, as his son is here, will be around with his CFO if you have any questions about our international project there in Uganda. And we have, again, 2 other meetings this afternoon. Environmental Sustainability Committee will be meeting in the Julep Room on the 3rd floor, and the Women in Rotary Committee will be meeting in the Boardroom 4 on the mezzanine level. And next week, again, our meeting will be Evans Miraji, the Harry T. Wilkes Artistic Director for the Cincinnati Opera. So thank you so very much for being with us today. Make it a great week and serve to change lives. Meeting adjourned. Thank you.